Just lay the back of the spine all the way down onto the floor so that the knees are bent, the soles of the feet are flat down onto the ground, and the chin is just tucking forwards and inwards towards the chest, so the back of the neck is long. We lift the hips up for a moment, shift them forwards so we could draw the hips towards the heels, and again just lay the back of the pelvis flat down onto the ground. Check that the chin is tucking forwards and downwards and into the chest. And bring the hands onto the belly. Soften the head of the arm bones and the top of the shoulder blades backwards and downwards towards the ground beneath. And then take a few moments just to find an easy flow of breath. So feel the belly expanding as you breathe in. And feel the belly softening as you breathe out. And each time you breathe out, just allow the hips and the pelvis and the back to settle and to relax, and maybe to spread just a little bit more all the way downwards towards the ground below. So sensing that the back and the pelvis and the hips and all the curves and the valleys of the spine can just descend a little bit deeper down towards the mat beneath you. And as you find another deep breath in, on the exhale, we'll hug the right knee in towards the chest. We'll just draw the right thigh all the way in towards the belly, interlace the fingers together around the top of the knee, and take a couple of moments just to feel again the lower spine heavy and the lumbar curve sinking all the way downwards towards the floor below. From here, we'll allow the right ankle just to come to settle onto the top of the left knee or onto the top of the left thigh. And we want the right knee to drop out towards the side. So this might be enough for you. If you can work a little bit further without putting any pressure onto the knee, just hug the left knee in towards the chest. Draw the left thigh in towards the belly, and notice that the closer the left thigh comes in towards you, the more of a stretch there is through the outer edge of the right leg, maybe within the groin or through the lower back itself. So keep the shoulders soft, keep the chin tucking in towards the chest. And if you want to work a little bit further, we can slide the right arm in the space between the thighs, bringing the left arm all the way around to interlace the top of the left thigh itself, the back of the left thigh itself. And let the hips be heavy, and breathe into the stretch through the back. So here we're taking all the pressure off the sciatic nerve, so the release and the relief should be pretty much immediate. Breathe into the belly, breathe into the hips, soften the lower spine down to the floor so that you can create some space in the hips and the pelvis each time you breathe in. Soften, let go into the exhale. And then when you're ready, as you breathe out again, just lower the left foot all the way down onto the floor. Let the right leg release. Take a couple of moments with the arms just soft by the sides, just to breathe, to notice the difference through the hips, to relax again through the base of the spine. And when you're ready, as you find yourself breathing out, hugging the left knee in towards the chest, drawing the left thigh in towards the belly. And again, keep the chin tucking forwards, keep the shoulders soft, breathe into the abdomen, relax the hips all the way downwards towards the ground beneath. Slow the breath. And when you're ready on the exhale, let's bring the left ankle to the top of the right knee or to the top of the right thigh. Again, if this is enough for you, it's fine to stay here. If you want to work a little bit further, hug the right knee in towards the chest, draw the right thigh in towards the belly. And if you want to work further still, we can bring the arms through and around to the back of the right leg. And again, continuing to breathe. So feel how heavy the hips can become, that the shoulders stay soft, and it might be a little easier on this side or it might be a little harder. So we're not symmetrical, so there's normally one side that feels a little bit more challenged than the other, one side that feels a little bit more open. A couple of deep breaths in, a couple of full breaths out. You're noticing how much more you can give up any internal effort each time the breath releases. And when you're ready, As you finally exhale, we'll lower the right foot all the way down to the floor. We release the left leg down along beside it, and we'll turn both toes in, turn both heels out, drop the knees together, let the hands rest onto the belly. Take a couple of moments just to breathe, just to notice the sensation through the lower back. Notice how much more of the spine you can soften and settle down towards the mat below. And just allow yourself to let go a little deeper into the exhale.